social worker.
Uh-oh.
Hi, Eva.
Hi, Dr. Katz. How are you? Nice to
I'm
see you.
glad
Thank
to
you for
see
coming.
you. Isn't this the first year of our celebration of social work where you're our social worker director?
It is. It's my maiden voyage.
That's great. Well, we've been thrilled to have you.
Well, thank you for having me. I'm thrilled to be here. All right, so it's 1:02, so we can go ahead and dive in. I anticipate folks will just continue to join. So hello, good afternoon, social work. Happy Friday. I'd like to extend a warm welcome to all the social workers and to our guests and colleagues here today. Social work for this next hour, your only role is to push pause and receive the recognition that is so well deserved and so hard earned. I know it can be a challenge because social workers are not generally in it for the fame and glory, but fame and glory for this next hour you shall get. You know, you're never not thinking about our patients, their families, and their communities. With social work, you run the marathons and you run the sprints. So just take a beat, breathe, and take it in. I'm going to share with you this slide. We have a theme every year. The NASW puts it out, National Association of Social Workers, and the theme this year is the time is right for social work. People become social workers because they have a strong desire to help others, make our society a better place to live for all. Social workers help drive significant positive changes in our nation. They push for voting rights, equal rights, Social Security, unemployment insurance, and other programs. Social workers, as you all well know, continue to work on the front lines throughout the pandemic, helping clients and patients get the health care they need, helping loved ones overcome grief and loss. Social workers continue to play a key role in helping people as this nation grapples with issues such as racism, economic uncertainty, deep political and cultural differences, and natural disasters. In short, the time is always right for social work. We know that every one of you gets into this work for the sense of purpose. So thank you for that. Just a very quick review. We're going to have a welcome. Dr. Katz, Dr. Cineas, Dr. Allen, and John Cancell will be offering some welcoming remarks. Ms. Christina Contreras will be delivering a keynote address, and then Ms. Cara Simpson and I are going to do a presentation of our social work champions for 2022. And then Moira Dolan, our colleague from DC 37, will offer some closing remarks. And if Yvette Villanueva is able to join us, she will also say a few words. Your MCs today, Ms. Cara Simpson. She's the Director of Behavioral Health Social Work at Jacobi. She's also my co-chair on the Social Work Council. And she has many other distinctions and accolades that she's far too humble to let me share in this medium. So I'm delighted to have her as my co-pilot today. And as you all know, I'm Eva Sanders. I'm the Senior Director for Social Work Services. I work here in Central Office, and I'm utterly privileged to be the director of this department. So thank you for having me. All right, so as I mentioned, we have some of our senior leadership who have graciously offered and agreed to offer some opening remarks. And we're going to start with Dr. Mitch Katz, our president and CEO. Dr. Katz.
Well, thanks, Eva, and we're so glad to have you. This is your first year as our social worker head on this recognition day, and we've been so glad that you've joined us, and we're happy to have Cara as the co-host and co-chair, and thank her for all of her work. I think we have to admit that the last 2 years have been incredibly hard on social workers. I mean, it's been hard on everyone, but social workers have been helping families deal with things that I think we all 3 years ago would have said were unimaginable, such as the death of a loved one all by themselves in a hospital room without a family nearby, or going months at a skilled nursing facility without being able to have a visitor, or being COVID positive and not wanting to return home to your multi-generational apartment where grandma lives, but you don't know where you'd stay otherwise. There have been so many challenges over the last 2 years that we could not have imagined, and yet in real time, our amazing social workers figured out the answer. I remember talking with a social worker about a family of ours where the child had lost both their parents at Elmhurst. And imagine, what that social worker had to do. So many difficult moments, but our social workers always rose to the occasion. They did what social workers do, which is to do what's necessary. I think that social work is an important part of all health systems, but I think it's especially important in health and hospitals because many of our patients are living in poverty. And living in poverty provides a set of additional life challenges when you're also sick or when a loved one is sick, including how to get transportation. How one of my patients recently talked to me about being cut off food stamps and not having any food to eat. Our patients who might get evicted or be preyed upon by people trying to, get their limited resources, immigration issues, substandard housing with mold growing on the walls. So many of the social determinants of health affect our patients and are helped by our phenomenal social workers. So I want to thank all of the people who every day, give their all to problem solve in a challenging environment to make life better for our patients, people who hold their hands, who get them through complicated family challenges, who counsel them, who support them, who give them the strength to go through another day. I thank all of you, and I'm honored to work with you. Thank you all.
Thank you so much, Dr. Katz. Very much appreciate you being here and for your kind words about social work. We know that you are forever a supporter of us, and so it's very much appreciated. And I'm going to turn it over to Dr. Natalia Sinius. She is a Senior Vice President and Chief Nursing Executive. And she oversees actually the whole entire Department of Social Work, through the Office of Patient-Centered Care. Dr. Sinius, take it away.
Thank you. And thank you, Eva and Kara, for your leadership. Good afternoon, everyone. And thank you all for joining us virtually for this exciting event, Social Work Champion Recognition. This event really allows us to commemorate and celebrate the caring, compassion, and commitment of more than 970 social workers employed throughout our amazing system. As most of you know, I am Natalia Sinius, and I have the privilege of serving as Senior Vice President, Chief Nurse Executive here at New York City Health and Hospitals. But I will say it is a privilege and an honor to really have social work services join OPCC in really acknowledging the amazing workforce that we have amongst our nurses and social workers. I'm delighted to welcome all of you here today to really shine the spotlight on those individuals who demonstrate day in and day out dedication, superior skills, commitment, and enthusiasm for the social work profession. The social workers that we honor today are individuals who display a deep devotion to providing compassionate and exemplary patient care and continually strive for excellence in both medicine and behavioral health fields. Our social workers take a holistic approach to patient care, identifying and evaluating the social, economic, and environmental factors that shape an individual's opportunities and barriers to engage in healthcare. Social workers serve as advocates and leaders, helping to affect positive change for individuals, for families, societal groups, and communities. I would like to amplify the advocacy component in greater detail. We know the social work profession is unique in that it requires social justice advocacy as part of the professional code of ethics, and therefore social workers are mandated to advance the rights of the most vulnerable in society, making the nation far more equitable and inclusive. This advocacy makes social workers essential to New York City Health and Hospitals, our mission and our vision to make sure that we're really delivering essential healthcare services to the most fragile and disadvantaged members of our society. Social work has been recognized as a profession for more than 120 years and has included leading social reformers, Jane Addams, former Labor Secretary Frances Perkins, and social rights leaders Dorothy Height, Whitney Young, and Ida B. Wells. The efforts of these high-profile social workers, joined by countless others in the trenches, have helped Americans secure voting rights, civil rights, Social Security, unemployment insurance, and many other beneficial programs. Throughout U.S. history, social workers have fought for safer workplaces and minimum wages, advocating for immigrants seeking asylum, raised awareness about HIV/AIDS prevention and treatment, supported marriage and employment protections for LGBTQ+ individuals, defended employment and reproductive rights for American women, and campaigned for client privacy and mental health services. According to the Bureau of Labor Statistics, social work is one of the fastest growing professions in the United States, with more than 700,000 professional social workers currently practicing. That number is expected to rise more than 800,000 by 2029. And by all accounts, the nation needs every single one of these social workers. Social workers have been on the front lines. There was a recent article that I shared with Eva that calls social workers the unsung heroes. And so today we want to shine the spotlight on all of you and to really commend all of you for the work that you've done. We see you and we need you. Social workers are invaluable to providing mental health and substance use disorder treatment, including addressing the ongoing opioid addiction crisis, protecting children from abuse and neglect, offering healthcare services, and finding emergency shelter for people experiencing homelessness, and helping people navigate all of the life's difficult and demanding challenges. Social workers are a vital and necessary part of interdisciplinary teams in hospitals, mental health centers, schools, nonprofit organizations, corporations, in the military, and in local, state, and federal government. In short, social workers are essential throughout society, and they are certainly indispensable here at New York City Health and Hospitals. I want to thank you again for joining us today. We salute our social workers for their compassion, for their dedication, for their ongoing contributions to society. We are extremely proud of all of your efforts to make a positive difference in the lives of our patients each and every day. So thank you, congratulations again.
Thank you, Dr. Sania, so much. And thank you for your enduring support of social work. And in speaking of advocacy, that's one of the ways in which you are so additionally incredibly supportive of social work at New York City Health and Hospitals. You're an incredible advocate. So thank you for that. I'm going to turn it over to Dr. Michelle Allen, our Chief Medical Officer and SVP. Dr. Allen, are you with us? I believe I saw you.
Yep.
All right.
Here.
Take it away.
So hard to follow Natalia. So Natalia, you can repeat that, everything you just said. And I agree 100%, 1,000% with everything Natalia said. And just to add a personal note, when I had to interact with social workers personally, when my mother actually was towards the end of her life, raising 2 small children, working as a resident, and then had a mom that was hospitalized, I had no idea what to do. And it was the social worker who took my hand, called me at the hospital, stayed in touch, and walked me through that whole process, that whole transition. And when she was re-hospitalized at yet another facility, the transition from going from an acute hospital to a post-acute hospital. How do I do that? How do I make the choice? Again, it was social work who came by my aid and made that transition an easy transition. And as many of you know, I'm an obstetrician, and my particular area of work has to do with women who are at risk for substance use, HIV infection, domestic violence. Every patient, and even if a patient didn't have an obvious need, social need, I couldn't have done any of what I've been doing over the past years without social work. Every time I saw a patient, she would need help with maybe housing, maybe childcare, maybe other entitlements. And once you do the depression screening, it's a social worker who usually helps with that as well in terms of counseling. So it's not just entitlements, it's personal counseling, and it's a treatment intervention. So throughout my professional life and even before that, I'm acutely aware of the role that social workers play. And when my son's girlfriend said that she wanted to become a social worker and she was going to apply to Hunter, I said it would be a privilege to write your letter of recommendation. So thank you to the social workers who have joined us today. Thank you to the social workers who have supported me in my career. And thank you to the social workers who supported all of our patients here in H&H. It's a privilege to be here today and to take a few minutes to honor all of you. Thank you.
Thank you so much, Dr. Allen. Send your son's girlfriend over our way. We'll take good care of her. And thank you also for your support. You know, every time we talk about social work, you have such a very clear vision of what social work is at its highest calling. And it is so incredibly lovely and appreciated. Thank you so much.
My pleasure and honor.
So next, I'd like to welcome John Cancell from our Office of Behavioral Health. John, take it away. The mic is yours.
Thank you, Eva. I appreciate it. And thank you, Eva, and thank you, Cara, for your leadership this year, especially during this transition year for many of us. So it's our sixth annual social work recognition celebration. I just want to say you are all my heroes, all the social workers who are being recognized, your supervisors, the facility leadership, the senior leadership that's here represented. Thank you. You all have done such great work as being social work leaders. And I don't know if I lost you.
Nope, we got you.
Am I still on? Okay.
You're still on.
I lost the screen, but I am still on. Okay. And I just want to, also recognize Dr. Charles Barron, who's supposed to be speaking. He asked that I speak, and I really appreciate that he is always behind us as a professional, as a leader, and I consider him honorary social worker, even though he's a doctor, because he's such an advocate for us. And having the theme being that the time is right for social work, we've been saying this for a while for those of us who've been doing social work and been at the front lines, that social work is such an integral part of all the services. And in behavioral health, especially, we look at it from many different angles, but you'll find us in mental health settings, substance use settings, and in various other settings, not just those traditional ones, but the non-traditional ones. And I do want to recognize also the social work leadership that's here at my office, who are spectacular in my eyes, Rebecca Lynn Walton, Janine Perazzo, Melanie Sanchez. The time is right for social work. We are showing that with leadership, with being at the front lines, with very innovative thinking, and trying to meet the needs of our clients in a compassionate, patient-centered way. Our profession is that bridge. Our profession is the calling that we answered when we decided to become social workers. As Dr. Allen's future daughter-in-law hopefully will be answering the call to be a social worker. These are all, we are paving the way for not just now, but for the future social workers. And from what I read, it looks like our profession is growing. It's got the potential of growing. By the end of the decade, we're going to be almost 1 million strong across the country. And so, it's an international cause, it's a national cause, and coming out of this pandemic, social work is right there at the front line. So the time is right for social work. It's our call to action. We rise to that occasion. We're going to pave that way, and hopefully, as partners to our other disciplines in this healthcare system, we will do right for our clients and for our patients. So happy Social Work Month. Thank you, Eva, for this opportunity, and Dr. Barron and all.
Great. Thank you so much, John. Very much appreciate your words and also representing the Office of Behavioral Health, which you're absolutely right, has a ton of social workers as leaders and social work adjacent folks as well. So we're very happy to have you here and have your support and partnership. So we're going to turn it over to our keynote address, Ms. Christina Contreras. I'd like to tell you a little bit about her before I turn the mic over to her. Born in the Dominican Republic, Christina Contreras is a proven healthcare leader that is passionate about improving the health of the community she serves. She is a highly driven and successful chief executive with over 27 years of progressive leadership experience and executive level management of inpatient, ambulatory, clinical, and ancillary services and hospital operations. Christina's demonstrated commitment to her staff, patients, and the community has made her a well-known and respected leader within New York City Health and Hospitals, the country's largest municipal healthcare system. She started her career as a caseworker and successfully progressed through various positions of leadership with increasing responsibility, culminating with her appointment as Chief Executive Officer, New York City Health and Hospitals, Metropolitan Hospital in East Harlem in April of 2021. Christina has a deep commitment to public service and is passionate about improving access to care for underserved and immigrant communities. Embracing the diversity of New York City, Christina engages and works with community leaders from all cultures, as well as local elected officials, to provide the public with health education and resources to improve health outcomes. During her tenure at New York City Health and Hospitals, she has successfully implemented a wide range of strategies to increase collaboration and engagement between staff, reduce costs, increase efficiencies, improve quality, and enhance patient satisfaction. Christina holds a bachelor's of social work from Lehman College, a master's degree in social work from Fordham University, and a second master's degree in public administration from Baruch College. In recognition of her leadership and service to the community, Christina has been the recipient of a variety of honors and awards, including Healthcare Hero 2021 Award from Schneps Media, the Government Service Leadership Award by 100 Hispanic Women National, a Hero of Hope and Champion of Inclusion by the New York City Hispanic Chamber of Commerce. She was selected as Power Woman of the Bronx in 2020 and named to City and State New York's 2021 Manhattan Power 100 list. She also serves as the chair of the National Dominican Day Parade since April 2021. So social workers, colleagues, it is my distinct pleasure and honor to introduce fellow social worker and current CEO of Metropolitan Hospital, Ms. Christina Contreras.
Thank you, Eva, for that great introduction. And thanks to all the senior leadership who presented before me and for their ongoing support. It's definitely a pleasure for me to be presenting to you all during this wonderful annual social work recognition event. And I'll be sharing my career path, some of my challenges and some of my struggles, how I transitioned from caseworker to a CEO, some of my guiding principles, and finally, a few tools that help me be successful, and I hope that it helps you as well. There's no one fits all or any one specific formula for success, but I'm just hoping to share the ones that I have been instrumental for me in my professional journey. I do have a PowerPoint presentation, and this is just to help me guide my conversation because I want to make sure I'm respectful of the time, and I want to touch on some points. Some of them you can read on your own, and also I want to make sure that we can, because otherwise we can control the conversation because I could talk for hours. I'm hoping that by the end of the presentation, you all feel inspired to advancing leadership positions. Next. When I saw the theme, I said, oh my God, yeah. The only thing I could think of is that the time is always right for social workers to emerge as leaders. Next. Social workers are everywhere. We know that, from a small community agency to large hospital systems such as this one, and even in the White House. The pandemic has definitely exposed some underlying issues around access to equitable care, mental health services, unemployment, food insecurities, homelessness, and other issues. Next. And although social workers sometimes rise to top leaders positions, we are kind of siloed in positions that I consider appropriate for social workers. These are admirable roles in which we served the greater community, but the world around us really need the full breadth of training and knowledge at all times. Next. So in this picture, I want to share with you how I made the transition from caseworker to senior leadership. The first one is when I first graduated from Lehman College. in 1995, and please don't add the years. And at that time, that's when I first started in health and hospitals as a caseworker. And by that time, I was mother of one. I had one child. And the next one, you see me. Currently, I've been in this position as the CEO of NYC Health and Hospitals Metropolitan for about a year. And now I'm mother of four. So I've been pretty busy. Next. Born in the Dominican Republic, like Eva mentioned, I immigrated to this country when I was 15 years old, and I didn't speak the English. I had to learn new language, culture, adapt to a new society, a new country altogether. And I encountered many challenges, some that I can go from stable housing, nutrition, clothing, education, and that's for a whole different presentation, but there was many, many challenges. Next. During high school, I was going through a lot of difficulties, and my grades reflected those challenges and my struggles. So my GPA was very, very low. And even though I was capable, there were many underlying issues that prevented me from focusing on schoolwork. And I had to deal with dysfunctional family and home environment. So it was interesting. At the time, I met a psychologist in the high school that they were trying a pilot program, and she became kind of my first mentor. She assigned a group for low-performing students, the ones that were struggling. And it was interesting enough because she recognized that I had the skills to start connecting with other people and empathizing with them. But I became like the informal leader. But the reason that I became the informal leader is because I really didn't want the attention on me. I wanted the attention on everybody else. And before I finished high school, I became also part of the statistics, unfortunately, at the time, because I also became a teenage mom. So I graduated with a diploma and a child. Next. Becoming a social worker. So after high school, I attended Lehman College. Right immediately after I graduated, I wanted to be a mental health professional. I stayed, I know that education was the key to a better life. I stayed focused. I worked 7 days a week. I had 2 jobs, full-time college, and I was also a full-time mom. I worked many odd jobs, retail, supermarkets, restaurants. I couldn't even name all of them here. I graduated with a bachelor's degree in social work, and at the same year, that's when I started my career in health and hospitals as a caseworker. I learned my job, my supervisor's job. I did everything to make sure that I can stand out from everyone else. I worked in many areas, and some of you can relate to this, discharge planning. I did HIV, sexual assault, domestic violence, substance abuse. I did training and teaching for prostitutes. I mean, I did it all, everything internal in the hospital. I worked in the ER, the inpatient, women's health, etc. So I'm just highlighting that because I'm sure a lot of people can relate to my experience. In 2001, I decided to go back to school to get my master's in social work from Fordham University. Continuing education was the key to getting promoted. And keep an eye on the keyword because I'm going to get back to that in a few. Next. Please don't laugh at me with this picture. So connecting to a purpose, right? So being a social worker, this picture was in Coney Island, by the way. Being a social worker was fulfilling, but I often found that there was only so much I could do for my patients. And I'm sure a lot of social workers can relate to that. Again, I'm not going to go into all the details, but it was often frustrating for me to know that I couldn't solve everybody's problem. So I already started to see a challenge for me in my social work profession. And I also wonder, I'm sure a lot of you wonder the same, am I really making a difference in the patient's life? Next. Transitioning from social worker to hospital leadership. So this is interesting. I started to be introduced to administration, and I realized that it gave me the ability and influence to kind of change policies, procedures, help some flows, streamline some flow, especially that I could still help the people that I started to help, but in a different capacity. And it was very fulfilling and rewarding for me. So it was kind of a flavor that I liked. I started doing that, and I said, wait, there's a lot of different ways that we can be helpful and instrumental and see it in real time. So I needed to continue. Again, at that point, I realized that I also needed to go back to school and continue to develop my education, which is when I went for my second master's in public administration, and this time from Baruch College in 2008. I hope you're not adding and subtracting because I'm in denial about my age. Next. So some of the leadership challenges, again, I don't want to take the entire presentation, but I thought it was very important for us to know, obviously, gender inequalities, there's a lot of challenges in leadership, and this is something that we have to recognize and acknowledge, because if we don't have an understanding of that, sometimes we don't realize why we're not able to move up in certain positions. So women, and this is important for us to know, women account for at least 6 to 7% of CEOs, in the 500 largest American companies, but less than 1% of women are women of color. That's really, really significant. When I look at the statistics a few years ago before the COVID pandemic, it was at least 2%, but it was still trending down. That's concerning to us. And this is why this is so important. I hope that by the end of the presentation, some of you feel inspired to fill those voids and increase that percentage. Again, as minority women, there are a lot of people who unfortunately do not look like us in leadership positions. The added challenges of being an immigrant, Hispanic, Black woman with an accent, don't forget that. And another perfect size according to the society norm. I mean, I'm perfect, but they don't think that I'm perfect, but it's okay. But those are things that make it's a reality that make things harder for us when we're trying to go for leadership positions. And I was often overlooked for promotions, but I didn't give up. I had to become my own advocate. As social workers, we know that we're so good at advocating for everybody else, but we never, or we think of us last. We never become our own advocate. You have to be in the forefront. You have to advocate for yourselves, for the profession. That's important. And also women being paid only 73 cents. Again, I'm not going to go into a lot of the details, but it's important that you know this. Women still get paid 55 cents for every dollar of a white man that gets paid in the same position. That's significant and very concerning. So my journey to leadership has been a challenging one, but I wouldn't change a thing because all of the experience led me to this place in my life now. I love what I do, and I love the opportunity to represent you all and influence others. I like to be especially an opportunity to represent minority women all throughout. And representation matters. That's important for us to know. Next. So social workers as leaders, being a social worker, I feel that has made me a better CEO. I love advocating for staff. First of all, I use the skills that I learned, how to assess the whole person, how to connect with people, matching the right skills to the right position, restructuring, empowering and mentoring others, using my personal experience to influence and guide young minority women just starting out of the careers. And I feel that we have a responsibility to help others. Also, it allows me to advocate for patients and community, supporting community programs that enhance patients' well-being, social determinants of health, understanding the need to connect to patients to resources. Next. And these are some of the ones that I'm sharing with you are some of what I consider my guiding principles, accountability and reliability. Understanding that as a leader, your behavior has an impact in an organization goals. Modeling the behavior you want your staff to display. Communication is a must. I can't say enough about that. You need like 5 slides just to go on communication. But the way that I see it, you have to have open, effective communication with everyone. It's essential that you can reach and understand and motivate others, build common understanding and inspire and trust. You can't inspire trust unless you're consistent and transparent with people. And lastly, but in terms of this slide, the strategic thinking. It's important to develop a vision for yourself, where you want to be. You're not going to reach there unless you have a vision of where you're heading. You can always change it, but you have to have a vision. You should be able to motivate others to work towards achieving that vision. My tools for success. I want to share some I want to share some of my tools. Eva, next. Some of my tools that I think they're important. Remember, I told you the key, education, I consider a key because education can open doors for you. Once you get through those doors, it's up to you to prove yourself and sustain the opportunities. But credentialing, it could be certification, it could be education, ongoing training. And I think everybody can relate to that. Ensuring that I had the right education that will open doors for additional opportunities for me. Continuing education, my success is a result of my love for learning. Mentors. We have to mentor others. We can't just know things, move up, and not give others the opportunity. Open doors for the next generation. Remember, they're going to be taking care of us. Motivating and mentoring others to grow, making a difference. Goal setting, short and long term. Delineate what small steps are needed to achieve your goals. Stay focused, work hard, and don't get distracted. It's very easy for us to get distracted and get off track, but you need to get yourself on track again. Next. And finally, something important that I want to share. It's important for us to have a strong support system, especially as you advance in leadership. So it could be your family, your friends. Don't forget that this journey, it can be very difficult and full of challenges. And it's important for us to get strength and support from others to stay focused. This is more or less This is more or less what a day in my life looks like. I just took a snapshot of a day in the meetings. I hope that I can, that I added some value to you all today, and that I can inspire many of you to become the next leaders and the next senior leadership that eventually will be presenting today. And it's a pleasure for me to present to you today. Thank you.
Wow, thank you so much. You were presenting, so you probably couldn't see the comments coming in, but
Oh, no.
you're inspiring left and right, and rightfully so. You know, it's such a moving journey that you shared, so thank you for that. And I think that a lot of the social workers can probably relate to how our sense of professional purpose really is an outgrowth of a professional journey. And I think the love of learning too, right, to your point. And I do think that that's also a key trait in social workers, because if we're not learning how to do social work or some other thing, right, we're learning about our patients. There's a genuine curiosity that I think we really lead with. And I'm quite sure every social worker on this WebEx can relate to being busy. You're very busy, both at work and in your life, caring for others. So totally want to reinforce what you said about self-care for all the social workers and for you, Ms. Contreras.
Thank you. Thank you. I appreciate it.
Thank you so much. And for all of you, Ms. Contreras offered, if you have any questions, any follow-up questions, please feel free to send them to Cara Simpson or to me, and then we'll put them together and send them on to her. So this doesn't have to be the end of the conversation. So again, thank you so much.
Thank
really
you.
Appreciate it.
Thank you.
All right, friends, it's that time. We're going to recognize our 2022 social work champions. Cara Simpson and I are going to tag team on presenting all of our folks who were nominated and identified as social work champions throughout our system. This is just a very high-level overview of sort of how much time goes into sort of making sure that social work has, you know, an appropriate level of recognition. And, you know, I just want to make sure it's clear that it's not just social work doing this. Ever since I started, I really had many other disciplines and professionals calling to say, how can we recognize social work? So it really is truly a community effort. In order to be eligible for a social work champion, you need to be a staff member who's a current licensed social worker and who's active on the New York City Health and Hospitals payroll. And then the nominees, really any eligible social worker whose performance and actions exemplify New York City Health and Hospitals mission, our I-CARE values. And in this year, the Social Work Council and the Social Work Leadership added in the NASW Code of Ethics as well. The nominees have demonstrated a significant and measurable impact. And staff were asked to nominate any coworker or colleagues, supervisor, subordinate. Each facility could decide whether they were going to have a behavioral health and a medical award or just one. And then you will see that reflected in the winners. But I also want to make clear that the nominations really did come flooding in from across the system and from across disciplines. And the winners were chosen by their facilities' individual social work recognition selection committees. And with that, I'm going to turn it over to my colleague, Cara Simpson, who will take us through the hospital's 2022 social work champions.
Okay, I would have to reshare. Is this the point where I upload? Can you hear me?
I can. Can you see my slides?
I can. I just wouldn't be able to move them, but that's fine.
Okay, just let me.
Okay.
I'll
Sure.
no problem.
So, okay, sorry guys. For Bellevue, for the medicine team, we have Lena and for the behavioral health team, we have Daniel Franco. Congratulations, guys. For Coney Island, we have for the medical team, we have Tassawar Janjua and Yilung David Ho from the behavioral health team. Congratulations, Coney Island. From Elmhurst, we have Karen Ramirez from the medical team, and we have Ann Thode from the behavioral health team. Congratulations, Elmhurst. Oh, we missed Harlem. Harlem, for the medical team, we have Lynn Tulak, and for the behavioral health team, we have Zoe Koskowski. Congratulations, guys, from Harlem. And from Jacoby, we have from the medicine team, Ladies Bell Garcia, and behavioral health, Renata Plonska Brown. Congratulations, everyone. From Kings County, we have from the medicine team, Mona Spencer, who's in the center of this picture. And from the behavioral health team, we have Crystal Vetschweg in the center as well. Congratulations, Kings County. From Lincoln, from the behavioral health team, we have Dania Descartes. And from the medicine team, we have Barry Alicia. Congratulations, Lincoln. From Metropolitan, from the medicine team, we have Rainier Scott. And from the behavioral health team, we have Cody Frank. Congratulations, Metropolitan. Yay. For North Central Bronx, we have from the medicine team, Michelle Green. And from the behavioral health team, Rose Tavares. Congratulations. Okay, from Queens, we have from the medicine team, Santush Varsi. And for behavioral health team, we have Sheree Anderson. Congratulations, Queens Hospital. From Woodhall, from the medicine team, we have Jemonique Etienne. And from behavioral health, we have Cleopatra Riley Phillip. Congratulations, Woodhall. And for our post-acute care, Eva?
Yep. Just a quick round of applause for everyone
Yes.
in the hospitals. Congratulations. Congratulations. Very well earned.
Absolutely.
I'm going to take you through our post-acute winners. Actually, Cara, if you can read the names just because of the way it's on the facility, then I can read the names just because of the way it's set up on my screen.
I can just go ahead and take it. From Carter, we have Emily Jolly. Congratulations, Emily. Okay, from Kohler, I'm going to try. Please don't hold me accountable for pronouncing the last name, but James Achilamikel. Congratulations. From Gouverneur, Jacinia Rodriguez. Congratulations. From McKinney, we have Bibi Safri Rakaz. Congratulations, Bibi. From Seaview, we have Deidre Figueroa. Congratulations.
All right. Congratulations, post-acute, and thank you for everything. All right. I will take you through Gotham. Be able to manage my screen. All right. From Belvis, we have Nancy Hernandez. Congratulations, Nancy. Thank you. From Cumberland, we have Marcos Rampoletto. Congratulations, Marcos. For East New York, Iris Rodriguez. Congrats, Iris. From Gouverneur, for medical, we have Mayu Burns. And for behavioral health, Andrea Kanalunga. Congratulations to you both. Thank you so much. From Mauritania, we have Linda Azon. And from Sydenham, we have Lin Sue Jolly. Congratulations, Lin Sue. From Tremont, we have Catherine Vasquez. Congratulations, Catherine. And from Vanderbilt, we have Zipporah Yoel. Congratulations, Zipporah. I wish I had an applause track, but applause for everyone at
Well, that's
for
something we can work on
everyone.
for next year.
Yes,
Next year
everyone
we'll
note
have
to
applause
self.
track. Yes. And for our
Congratulations, Gotham.
yes.
All
And
right, for community
community
care.
care. Yes. Okay, for our certified health home agency, congratulations, Donna Allian Sinclair. From our health home, we have Lauren Keshanover. Congratulations. And from correctional health, congratulations, Melissa Ravello.
Congratulations, community care, and to corrections. Thank you
correctional
guys
health.
for everything.
All your hard work.
Yeah.
Thank you.
I'm going to take you through our central office programs. So for our maternal home, the winner is Monique Irick. Thank you, Monique. From Office of Behavioral Health, Sally May, who works with the Be Heard program. Congratulations, Sally. And then for our final award, we're always talking about as leadership how we can improve upon this process, and we added an additional award this year related to innovation and partnership, and it goes to our colleague Cheryl Dury. This category was an outgrowth of the criteria, and one of which is to promote and protect as both innovator and advocate the health, the welfare, and the safety of the people of the city of New York. And Cheryl Dury was nominated by our central office housing team, Christine Flaherty, Leora Hontef, and Fanula Seifert. And they wrote that Central Office Housing for Health team is partnering with Kohler to move undomiciled patients who are medically cleared for discharge into permanent housing in the community. Cheryl has worked tirelessly for patients at Kohler to connect them to permanent housing, including identifying patients for housing, assisting with housing applications and viewings, and supporting patients so that they feel ready to make the transition into permanent housing. Her work is a testament to compassionate and excellent care. She cares deeply for her clients and goes the extra mile to ensure their needs are met. For example, she has coached one of her patients who is ready for discharge but scared to exit to feel ready for housing. And then through the housing process, from bringing in assistance for supportive housing, eligibility, to bringing the patient to a bank to open up an account for when they transitioned into the community. That patient is now moving into a new supportive housing building in Brooklyn. And I want to congratulate Cheryl, and like Cheryl, she is not here today because she is working through the weekend. So she's taking some well-deserved respite. So congratulations, Cheryl. And again, congratulations to all of our winners. We're going to have plaques made and delivered to you soon, and hopefully we'll have a little photo shoot here at Central Office for anyone who is willing and able to attend, and we'll let you know when that is in email. So again, congratulations, so well deserved, and thank you so, so much. All right, so it is time for our closing remarks. And our labor colleague, Moira Dolan, she's the Senior Assistant Director of DC 37, and social work is within her umbrella, generously agreed to offer our closing remarks. So Moira, I hand you the mic. Thank you for being here.
Thank you, everyone. I've been looking at the names on the list, and I recognize a number of you. I've been working with your chapter for more than 20 years, and with various health and hospitals administrations. And I have to say, I finally feel like we are really being heard and making progress. I'm very proud to work with your chapter leadership, with Carmen De Leon, your president of Local 768, and with Karen Ramirez and the team that's working with her. In all the facilities, you have built up a great network, and I encourage you to get involved. The union, I heard Dr. Katz and several of the others speak about how much you are supporting patients and literally and figuratively holding people's hands. The union is here to hold your hands, and you are the union. You are the ones holding each other's hands. So your chapter has been great in organizing. Just a highlight of a couple of the successes that we've had over the last couple of years. In 2017, the union advocated for a salary review panel to bring facilities into line with each other, because there was a lot of disparity going on amongst facilities. In 2019, we allocated money from the equity panel, and we eliminated, along with the participation of H&H, eliminated level 1, brought people up to level 2. We don't use the new higher rate anymore. And in 2021, we have mutually agreed that LCSWs are going to be level 3s now. So there's been significant movement in the last couple of years in terms of pay. We know we still have a long way to go in terms of the market rate, but please be assured that the union and the administration is working towards making a difference. Also, in this last year, we've had the establishment of social work councils that the union and management is participating in, where we were part of advocating to have Ms. Sanders come on. Not only us, we know there was many others involved, but definitely it has helped to have her in this leadership role. And also keep in mind that you have, through your contract, educational leave days. So in terms of helping each other and holding each other's hands, you need to know about what your benefits are in the union. I do encourage you to look at your local website, local768.net, which has lots of great information. You have educational leave days. You can get reimbursement for continuing education classes that you need to get. And you have paid family leave so that you can take care of yourself and your family. So it's not only your patients that you're taking care of. And the union is actively working to protect your premium-free health insurance. You are among the last employees in almost the country to have premium-free health insurance. So while your wages are probably not what you want, you have to think about total compensation and that you are not paying a premium copay, which is a significant benefit. And that continues even after you retire for you and your spouse. So keep holding each other's hands. Thank you.
Great. Thank you so much, Moira. And thank you so much for your partnership. It is so appreciated. I'd really like to underscore a couple things that Moira said, one of which is around self-care. Do use your time. If you see hours and hours and hours and hours building up, you need to take time. Social workers are amazing at advocating for self-care, and we need to extend that to ourselves. And education hours. Absolutely. And I know that I can safely speak for the social work directors that we are all very invested in making sure you have access to sort of continue to develop professionally. And if you have any confusion about the hours, et cetera, please ask a supervisor, please ask a director. We really are here to to help you grow, and very much appreciate you being part of this. And I also do just want to give a quick plug around shared governance, which Moira had also mentioned. We just established our first councils, and so it is still very much under construction, but it is moving forward. And I really want to invite everyone, if you have any questions about it, if you want to talk about it, call, email. Karen Ramirez, Priscilla Collado, and Jane Lima Negron are the leadership of the system-wide social work council for frontline staff. They're also available. It's a key thing that we're going to really be moving with this year, because as a profession, we really promote our clients and our patients having their voice amplified and maximized, and shared governance is the infrastructure for social work to amplify its own voice and its own expertise. So really, please try and be part of it. All right. I don't know if Yvette had a chance to join us. I don't think so. She's sorry that she couldn't be here today. She got pulled away at the last minute. All right. So I just want to say a quick thanks. It's a very short list of all of the folks it took to get this going today. It truly was a community effort. Special thanks to Dr. Katz, to Dr. Sinius, Dr. Allen, Dr. Barron, John Cancell, Ms. Contreras for an incredibly inspiring keynote address. We are going to have you back. Ms. Natasha Burke, Moira, Ms. Carmen De Leon of DC 37 and Local 768, Davika Brown, Zenja Santos, Kavita Ahern, Linda Brooks, Alexis Hernandez, and Lamont Williams, the admins who make all the things move. Thank you guys so much. Ms. Cara Simpson, the Office of Patient-Centered Care, Office of Behavioral Health, Communications and Marketing, the Recognition and Planning Committee members, the CEOs, CNOs, and CMOs. And I want to make sure that there's a very wholehearted thanks for all of the social work directors, the associate directors, the leadership. You are all very key in really setting a vision for how we wanted this recognition to go. And I know that it's a continued thing that we are building and improving. So thank you guys so much for your partnership and for your support of our amazing social work staff. And with that, we are at our conclusion. We still have 1 minute left, and I invite you all to not go back to work. Give yourselves a minute.
A minute break.
Breath.
Okay.
Use that minute to your advantage and have a beautiful weekend. Happy Social Work Month, all. Thank you.
Happy Social Work Month. Thank you.